Welcome to Thrive with Pride from AgeOptions, an online space for LGBT older adults and those who care for them. This is a recording of a live event, our collaboration with the Illinois Senior Medicare Patrol, or SMP. Miranda Davis spoke to us about how to prevent, detect, and report fraud, and we had a lively discussion afterwards, which was not recorded. Please join us again on November 24th at 11 a.m. when we will be live on Zoom with a discussion about caregiving in the LGBT community. Please help us by filling out the survey in the video description below. In that video description, you'll also find lots of helpful information and phone numbers. Thanks for watching. And I'd like to introduce my colleague, Miranda Davis. Miranda graduated with her master's in social work from Miami University of Ohio and joined AgeOptions in September of 2019 as the Senior Medicare Patrol, or SMP, as you'll see in this presentation, outreach specialist. In her role, she works to empower older adults to prevent, detect, and protect healthcare fraud through outreach and education. Before joining AgeOptions, she worked as a counselor and taught parenting classes. Miranda became passionate about working with older adults after taking an adulthood and aging summer course. And she believes that working to prevent healthcare fraud is one of the very first steps we can take to sustain a healthy mindset and physical well-being. So Miranda, thanks so much for being here, and I will let you take it away.
Thank you so much for that introduction. I feel like I couldn't have done better than that. So it's always nice to have somebody kind of introduce you. So thank you so much for having me. We can get started whenever you are ready.
Okay, I'll go to the next slide.
Yeah, so today's presentation is going to cover types of Medicare fraud. Our agenda is looking like this. Today we're going to learn about the types of Medicare fraud in our respective communities. I'm going to be talking about terms such as homebound, skilled care, plan of care, often terms that are misconstrued because a lot of people don't understand them. I'm also going to be talking about the examples of potential Medicare fraud, go over the different things that I'm seeing as I take the phone calls and hotline calls for the state of Illinois for those reporting potential fraud. And then our SMP message is how to protect, detect, and report Medicare fraud. So that's our mission, that's our goal, that's my reason for being here today, just to assist you all with understanding what's going on, especially as fraud is on the rise. So next slide, please. So the three different types of Medicare fraud, we typically like to use the term potential fraud because we don't want everybody thinking that everything is fraud, right? What I've seen come through my office is home health fraud, durable medical equipment fraud, which is extremely pervasive right now as open enrollment just passed, and I'll talk about that a little bit later. And then the genetic testing scams. So home health and Medicare fraud. What is home health? For starters, in order to receive home health care, your doctor must certify that you are three things. You must be considered homebound, you must need a skilled care, and you must also have a plan of care. So these three things as an umbrella term certifies you for home health under Medicare. So now I'm going to get into some definitions really quickly. So when someone is considered homebound under Medicare, it means that they cannot leave their home without tax and effort. A lot of people tend to believe that you're homebound means that you're bedbound. That's not what that means. Homebound means that you may need somebody to help you, a professional caregiver, home aide, or something like that. Skilled care, though, are services that also require a licensed staff, such as a nurse or physical therapist, or whatever other licensed staff that you may need that is also for the home. A plan of care under home health are services that are provided by healthcare professionals that need to be prescribed to you by your doctor. So it's really important that the plan of care is by your PCP or your provider in this case. So what are some examples of home health fraud? So what I've been recently getting from a lot of people who call our office and say, hey, I think home health fraud has taken place. It's typically an example like this. You attend a health fair or a home health agency. They'll say they can provide free services to you. You sign up because, I mean, after all, you qualify under whatever bracket they have. Maybe it's your age or something like that. And they send a person to your home. This person that they're sending to your home under whatever flyer it is that they're giving out to you at the home health agency or health fair has a person who's probably not a professional or licensed individual who comes to your home and check your blood pressure, right? No big deal. Because after all, it's supposed to be free. So following this service, you receive a notice, typically your Medicare Summary Notice that comes out quarterly, that they billed your Medicare for home health services. As you can see in these 3 bullet points right here, this person just checked your blood pressure. Home health requires 3 things, right? Mentioned previously, that you needed to have skilled care, a plan of care, and be considered homebound under your provider's jurisdiction or whatever that person is saying. So this is what that looks like. We'll talk about how we can kind of tackle this type of a fraud later in our question and answers. But for the purposes of understanding what home health fraud looks like, that is what it will look like. Next slide, please. Genetic testing fraud. This is another one that's really big and on the rise as well. So genetic testing fraud occurs when Medicare is billed for a test or a screening that was not considered medically necessary and or it was not ordered by your treating physician. So private agencies, they typically will have signs such as, are you or anyone in your family at risk for cancer? Get free genetic testing covered under Medicare. This can also happen in community or health fairs, senior centers, anywhere where you see a sign that's, asking about your risk for cancer or anything that's free under genetic testing or Medicare, you should automatically suspect that it's a red flag because this too needs to be ordered by your physician. Okay, so this is the most widespread, the durable medical equipment, which is really important for all of us listening today, because this is the one I'm seeing more often than not. So what is durable medical equipment? Just to let you know, the durable medical equipment includes things that are for your home, right? Or Part B equipment. That's walkers, crutches, canes, wheelchairs, patient lifts, hospital beds, back and knee braces. So Part B is your medical insurance under Medicare that covers medically necessary durable medical equipment if your doctor prescribes it as a part of your home care. And it's mainly used in a home. And then I'll just talk about what this type of fraud looks like as well. But really quickly though, a lot of the DME fraud is going to come through by way of a phone call, a robocall, press 1, maybe it's a survey that you may have filled out. But here's just a typical example. A caller stated, so you're Mr. Smith, right? A caller stated that Mr. Smith was eligible for free services under Medicare. Mr. Smith accidentally gives his Medicare away, his number away to the caller. Afterwards, he receives a back brace that his doctor did not prescribe, did not fit him. And a month later, Mr. Smith was charged over $1,000, which typically shows up on that Medicare Summary Notice. So in this case, when someone's calling you, is typically saying that, well, I guess I'll give you the most recent example. It's the red, white, and blue card, your Medicare card if you have it, or you know, what that looks like, is that they're asking if you received it for one, and that there's a new update to it for the Medicare card. And then once they get your Medicare number, they then begin trying to diagnose you over the phone, typically asking questions about knee and back pain or foot pain or whatever part of your body, right? And then they're saying that the services are free. And then, of course, like any person who thinks that they're getting free services are like, okay, it's not being charged to me. Medicare is covering this as a part of the Medicare and You 2021 plan, and they don't know. So they give the number away. And the interesting thing is that the durable medical equipment does come to your home. It does come to your home, so it looks legit. It looks like, you know, no crime has happened. But you need to know that these things need to be prescribed to you by your primary care provider. And also, the equipment that's being sent to you does not fit you, right? To get prescribed for something, it needs to be fit just for you. So, and then I can answer more questions later regarding those types of fraud. Again, I do want to mention that this is a very, very cutthroat and short part of our presentation. It's much longer and we go in more depth, and it's super interactive. But for the purposes of getting our message out today, it's really important that we talk about how to protect, detect, and report. The first step into protecting yourself from any type of fraud is to always show up, right? Show up to educational, you can go to the next slide, thank you. You always want to show up to presentations such as this one, right? But to prevent it or protect yourself, you do not want to sign up for services out in public. If you need home health or any type of testing, you want to talk to your doctor first. A lot of this seems very simple, but it really is important that you speak to your doctor first. A lot of people are trying to sign you up for things out in the community. Just be aware, right? So if you're getting home health, ask for a copy of your plan of care. Typically, if it's a potential fraudulent case, they wouldn't be able to give you a plan of care because they would have to have diagnosed you and know your healthcare needs, which they don't. You do not want to sign any time sheets or anything like that without reading them. Do not sign any blank forms. It's really important that that's a step to protect yourself in the first place. In the case of Mr. Smith, he wasn't able to protect himself, right? He gave out the Medicare number over the phone. So let's just say that happened. Okay, that happened, right? You gave that number out. No crime has taken place just yet. The next step that you want to do is to detect. Once you've protected yourself, now, okay, or if you fail to protect yourself, excuse me, you can detect. To detect it though, you want to get a you want to get a list of medical services you received from your doctor. And you want to compare that list. Typically, if I was in person, I would give you something called a personal healthcare journal. And what this does is cross-check the different type of providers you've seen, you know, have prescriptions of your medication, different allergies, just have all your healthcare information in one place, just so you won't carry all of your documents with you to be either taken or, you know, just protecting yourself. It's like a preliminary step. You want to watch for things on your Medicare Summary Notice or Explanation of Benefits, which is your private insurance, for services that you did not receive, services that were not ordered by your doctor, or possible billing errors. So to this next bullet point, services that were not ordered by your doctor, that would be that durable medical equipment example with Mr. Smith, right? So he received that phone call, gave his number away, potentially received that DME equipment. So these are how you can detect it. Again, it shows up on your Medicare Summary Notice, in which case you should suspect fraud and give the Illinois SMP a phone call. Okay, let's just say, no big deal, Miranda. I didn't have any of the following issues. I'm fine. And if you're fine, that's great. You still want to give us a call though, just to let us know that you did receive a call if somebody, you know, either pretending to be for Medicare, as we know Medicare will never call us, right? Or the worst could happen. oh my gosh, I gave my number out and now I'm receiving boxes and I'm receiving things that were not ordered by my physician. So step 3 is to report. You also want to report to me if you're in the state of Illinois. So if you have questions about services that you did not receive, you first want to contact your doctor or home health agency first, because it's possible that an error could have taken place. You don't want to suspect fraud always, right? So make sure you work with your doctor, and if your doctor can't explain it, home health agency can't explain it, then you know that something's up, right? So if it doesn't work to reach your home health agency or doctor, you should suspect fraud. So that's seeing that claim on your Medicare Summary Notice for service that you never received. I can write this number in the chat box, calling it Illinois SMP program at 1-800-699-9043 for those of you who wanted to hear it, and then I can also put it in the chat box as well. So these are our 3 steps to get you motivated, really, to understanding the types of fraud and what you can do as a response to witnessing what's going on. So I do want to leave you with this. I want you guys to always, ladies and gents, or whatever your pronouns, excuse me, work with your doctor, right? So if you need medical services or equipment, you and your doctor make that decision. Again, your doctor is the only person who knows your healthcare needs, not somebody calling you over the phone, not an advertisement on television, not out in the community who's just taking your blood pressure and saying that is home health services, okay? You only want to give your Medicare number to your trusted doctor. Can't reinforce that enough. And of course, your Medicare enrolled provider will write you an order for services or equipment when it is medically necessary. In other words, you can't come with an issue when it's not really one, because your doctor diagnose and make those referrals for you. Next slide. Here are a list of resources. Illinois SMP, that's me. It looks like a 1-800 number, but you will be speaking to myself, Miranda Davis. Social Security Administration, really great resource. Again, these are some of the fraud schemes people call and claiming to be from Social Security. They won't call you. CMS wouldn't call you. That's the Center for Medicare and Medicaid Services. The Better Business Bureau. These are folks you can call and say, hey, they were calling claiming to be from XYZ business. The Federal Trade Commission, one that I typically refer people out to because it's a lot of identity theft. Again, they're giving out, or they're asking you for your Medicare number, your Social Security number. It's a really great resource. SHIP, the Illinois Senior Health Insurance Program, really great resource. Again, they can help you with benefits, kind of go over different type of questions that you have in regards to Medicare. And of course, the Elder Care Locator, which is a website.
Thanks again to Miranda for her lively and informative presentation. Again, please check the video description below for all the information and phone numbers Miranda listed. Please remember, too, Medicare Open Enrollment is October 15th through December 7th of every year. And every year, you need to check and make sure that your plan is the best plan for you. Medicare plans change every year, and the best plan for you in 2020 may not work at all for you in 2021. It's confusing, but you don't have to do it alone. Please call AgeOptions to find a senior health insurance program counselor near you who will offer you free help on choosing the best plan. Again, we'll be live again on Zoom November 24th at 11 a.m. with a discussion about caregiving in the LGBT community and how we can support those who need care and those who provide care. Please help us by filling out the brief survey in the video description below so we can tell our funders how this program matters to you. There's also lots of helpful information and phone numbers below, lots of links as well. Thanks for watching.